topic of my presentation in this meeting was the use of bronchodilator by athletes and the possible abuse of bronchodilators in Olympic and other sports competitions. The problem is that asthmatic athletes have the right to be treated for their asthma, because otherwise they would be at a disadvantage in comparison to their competitors. Now the problem was that years ago it was realized that the beta agonists were used more and more by athletes in the Olympic Games, so the Olympic Committee decided to restrict the use of bronchodilators by this category of persons. Now the problem is because the bronchodilators have an ergogenic effect if taken by oral route, but not by inhaled route. So the issue is to determine if an athlete is using beta agonist to improve its or her pulmonary conditions, or to improve or increase the muscle mass. Recent studies have shown that the inhaled beta agonists have no ergogenic effect. So there are some restrictions in terms of maximum dose allowed, which is much higher than the usual therapeutic dose, and the finding in the urine analysis of concentrations less than some thresholds determined for each compound. So the point is that athletes need to be treated for their asthma with bronchodilators, in addition, obviously, to inhaled corticosteroids, because they need to be treated in the same way as the general asthmatic population. There is no evidence that the inhaled bronchodilators have ergogenic effect, so it's important that these subjects are appropriately treated without too many restrictions. On the other hand, it has been observed that in some cases, some athletes incur the problem of too high concentration in the urine because of the loss of liquids. So the too high concentration of urine, and this has a problem that has to be solved. In any case, the conclusion is that athletes have the right to be treated with bronchodilators, and possibly with bronchodilators who do not incur the desensitization problem and are not taken by oral route, of course.